I want to let it go. Therapy for depression is rising. The strong stigma in Korea toward mental illness sometimes goes as far as ridiculous rumors that having a medical record for it will hinder admission to a prestigious university or employment with a good company. Being labeled as a crazy person is one of the biggest fears for Koreans who care much about saving face for themselves and their families. That, however, is becoming a thing of the past. Although slow, the tide is nonetheless turning as more people are increasingly reaching out for help when feeling mental distress. The number of patients who paid a visit to hospitals due to mental illness grew from 2.9 million in 2015 to 4.1 million in 2021, a whopping 72% increase, according to data from the National Health Insurance Service. You should lead the way. The changing perception of the treatment of mental illness has been led by the young generation who are less influenced by the traditional values in Korea. In the past, talking about emotion, especially hardships, was considered taboo by Confucian values, which dictated the strict code of conduct in the country. The China-originated belief system cherished group harmony, leading to a culture that held obedience to those who are older as virtue. Under such conditions, freely expressing negative emotion was strictly shunned. But the younger demographic in Korea, represented by the so-called MZ generation, millennials and Generation Z, is defying such tradition. Interest in the wellness of mental health took up in the mid-2000s, but the speed has picked up recently due to various reasons, including a growing desire for self-expression, even if that's hardship through various channels like social media. Professor Lee of Chungang University's Department of Sociology said, getting psychotherapy came from Western culture, and Korea was very late to accept it. The younger generation tendency to deviate from the influence of traditional values has led to widening interest in mental wellness. Positive ripple effect. Celebrities or public figures admitting to unstable mental health and getting help are also helping to resolve the long-standing stigma around mental illness. A recent study by the University of Ulsan's College of Medicine revealed that celebrities going public about mental illness lead to more people getting treatment. Comparing the number of new patients per 100,000 who were diagnosed with anxiety before 2010, when a slew of celebrities confessed to hardships, and 2021, the figure went up from 65 to 610, posting a 9.4-fold increase, the study said. What can be done? Although the trend is changing, there's room for further improvement. Considering the high suicide rate in Korea, the latest shift in perception is still too meager, experts say. The country's suicide rate has been number one among OECD countries for more than 20 years, and experts find depression and anxiety to be core reasons. The government is also approaching the situation with a heavy heart. The Ministry of Health and Welfare recently launched a counseling program for the entire depressed population in the country, the first time a mental health counseling program covering all demographics has been established. Before, such initiatives were fragmented into those targeting the youth or the elderly. The program started out to address the high suicide rate in Korea, which was largely found to have derived from a high depression rate. The reason why we are promoting counseling instead of medical treatment at a hospital is to lower the entry barrier and make it more accessible.